Obviously my gloves would be coming from a sterile dispenser. They would be laying on a bathroom counter. I'm gonna get one on, and then while I'm getting the other one on, we're gonna go take a look at the patient. I'm suspecting that we're dealing with what looks like a venous ulcer. I got to that conclusion via the wound bed, and also because of the fact that 2 weeks in the hospital fighting with pneumonia led to this thing becoming, going from the size of a dime to the monstrosity that we see now. I mean, I wouldn't say a monstrosity in front of the patient, obviously, but it's quite a bit bigger. It's about, well, we're gonna go measure it. Yeah, let's go have a look. Okay, so my 12 o'clock position is that way, 6 o'clock is this way. This is the lateral malleolus, which usually is where arterial ulcers would pop up. But here we see the hemosiderin staining, and also the peri wound looks like it almost has some eczema on it. The wound bed for me was one of the biggest clinchers as far as the decision making goes, because of all the slough and the what looks like granulation tissue underneath here. And we wouldn't have that beefy looking granulation tissue if there wasn't enough blood supply. Also, yeah, that 2 weeks in the hospital, it makes sense that bed rest, having your feet up, would exacerbate a venous ulcer more than it would an arterial ulcer. And yeah, none of this presents as, a diabetic ulcer. It's not dry. And also the other thing is like the wound boundary here, the edge of the wound isn't punched out. So I'm thinking it's venous in nature. Let's measure it quickly here. 12 to 6, we've got about 5.3 centimeters. And then 3 o'clock to 9 o'clock, we've got about 5.2 centimeters. No presence of undermining or tunneling that we can see. Maybe a little tiny shadow here, but with a 2D image, I'm gonna say not really, no. Yeah, the exudate looks like slough. Peri wound looks like there might be some presence of eczema, and the hemosiderin staining also makes me think that even though this is on the lateral malleolus, I think this is venous in nature. Thank you.